Hello, everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And joining me once again is Dr. Rashid Chotani. He is a COVID-19 researcher and infectious disease specialist. Thank you so much, Doctor, for once again joining us. Appreciate it.
Thank you for having me, Heather. It's always a pleasure to be with you on this call every Friday and talk about something that we both are and the entire nation is extremely concerned about.
Yeah, I want to talk with you today about your recent travels to Texas and what you experienced there. I know that you went to the small town of Laredo.
Yes, it was quite amazing to travel during this particular period, and the observations that one takes in as they move from point A to point B. First of all, it took I had to wear the mask for about exactly almost 10 hours from the time that I left my home to the time that I got to the hotel room where I could then take off that N95. So it was pretty difficult to do that. And I can appreciate how people get so irritated to wear a mask, but I did wear a mask the whole time. What I observed was that everybody at the airport, whether it was I flew out of Washington, D.C., Reagan Airport. From there all the way to the hotel that I was in Laredo, everybody was wearing a mask. It was mandatory, which was really absolutely amazing for me to see. The airports had clear areas where people could actually sit and eat, but at distance. So every precaution was being taken at the hotel. All the markings were there. Even with security, going through security, it was not TSA has managed things really well. Of course, there's a less number of people. There are less number of people that are flying out or in, but the work that was being done was amazing, and I was really pleased with what I saw. The other observation was that yes, most of the restaurants and the stores at the airports are closed. So obviously they're getting affected by that. When I was looking out of when I was, going to Houston, and I looked out and saw the highways, they were literally empty. And and when I got to Laredo, the highways and the big avenues were empty. So yes, there is very little traffic out there, which is very good for the environment, but obviously it's not very good for the economy. So yes, you can see the effects of it in a major way as you travel from point A to point B.
Yeah, that's obviously the economic effects. Talk a little bit about what took you to Laredo and what you experienced there when it comes to the coronavirus.
So as you know that California, Florida, Arizona, these are the hotbeds of COVID-19 right now. And in Texas, specifically, Laredo is a border town between Mexico and U.S. There are a lot of very few hospitals over there. Not too many beds. It's a small town, but in this small town, they're seeing positive. They're seeing 300 patients every single day that are positive. Now, if there are 300 individuals who are positive for COVID-19, X number of them are going to go to the hospital. And right now, they're almost filled to capacity in the hospitals in terms of hospital beds. There are some hospital beds that are still available, but the ICU beds are filled almost. And in many cases, they have to drive patients not only from Laredo, but from the neighboring county, which is a small county, all the way to San Antonio, which is a 3.5 hour to 4 hour drive. So, you have to have a medical intensive care unit fitted ambulance where you have intubated an individual. That individual who is intubated is being transferred from point A to point B, and that time period is about 3.5 hours, which is a very, very long time. So I was asked by the Texas Emergency Management Department through the governor's office, and it's they're trying to do their best, and all the physicians and all the folks are trying to figure out how to take care of the individuals who are in problems. So one of the things that we wanted to do was to make some assessments in terms of if they will be needing an additional stand-up hospital, if they'll be needing additional intensive care unit beds. And we spent almost 1.5 days working on all of that with the entire team that came in from San Antonio, Austin, various other places from the emergency management perspective, as well as people that were local, fire department, police department, and all the chiefs of all the departments, including myself and a colleague of mine, as well as a few other people that had flown in from Florida, from different parts of the country, including myself from DC. So it was a pretty large team, and we spent a lot of time figuring out what potentially needs to be done to save lives that would be lost if we did not have the proper facilities to take care of things.
And so what was the determination? Do you think that that small little border town will in fact need an additional hospital, a temporary hospital to handle the number of folks that might get sick?
So we are still working through that, but the consensus was that yes, there should be a small stand-up temporary hospital. And there should be something that would provide individuals with negative pressure rooms that are not exactly intensive care unit beds, but kind of like intensive care unit beds, so that they could be stabilized and till appropriate rooms are found for them. If that is needed, they would be moved from there. But the problem, as you can see, that in a small town, even a small number of cases, right, 300 cases which are positive. And if you are getting admissions, maybe 10% of admissions, and there are a small number of beds, if you start seeing that every single day, in about a week or so, you will be running out of beds, you'll be running out of ICU beds, etc. So, the impressive thing was that the Texas Emergency Management Department, under the leadership of Governor Abbott, is seriously taking a look at all the things that are going on and trying to make sure that they're prepared and ready for any thing, even if it's a small town, to make sure that lives are not lost, which is really what public health is all about. And I was really happy to see that.
Yeah, that obviously is the goal. I want to broaden out now, Doctor, and talk about the national picture. It's been a week since we last spoke. Your thoughts on what we're seeing as a country in combating the pandemic?
So as you can see that the a number of cases are higher than what used to be. If we look at New York, for example, right? And if we look at the number of cases and the number of deaths in New York, right now what we are seeing is that we are seeing more number of cases outside New York across the United States, but we're seeing less number of deaths. And there are three reasons behind it, I believe. One main reason is that a majority of the people that are now turning out positive are younger individuals that will not develop serious disease. So my message to all the teenagers, and I was one, and I felt invincible, and I believe they feel invincible. And yes, they have a lot more resistance in terms of dealing with diseases, but what happens is that they will take the disease back to their families, and I want them to be very cautious. If we are going to control anything, the young folks in America need to get on board. The second reason for the less number of deaths is that in the United States, we've done a tremendous thing in terms of nursing homes to contain the virus over there, because as everybody knows that a lot of deaths happen in nursing homes. Now the deaths are not happening because we contain those environments so the disease does not get inside a nursing home. And the third thing is that, we always have to be very cautious and remember that deaths follow 2 weeks after the cases peak. So we might still be looking at and wondering what is going on with the data and where the numbers are at this point. And that is something that we've got to do vigilantly every single day to make sure that we have the right data and we evaluate the data properly.
And speaking of data, I can't let you go without asking about the flaw in the system here, especially in California. There is a technical glitch. State authorities have admitted that, and they say that the number of cases here in California may be higher than what the current data shows. How impactful could that be?
So that's a very important question and a critical observation, and I'm delighted that people are accepting the fact that there is a flaw in the data. Now I've talked to a lot of health officers in California as well as in Texas, and what I have learned from them is that because of, by the way, just so that we're just not facing coronavirus. We also had, hurricane season is up, and a lot of states have been affected by that. And, the data entry, data processing, and all that is affected by that based upon the conversations that I've had with folks in Texas and other states. And there is a delay in some of the data. And some of the websites, in fact, claim that there is some delay in the entry of the data. So yes, unfortunately, it might be that we have a lot more cases that what we are seeing right now on the dashboards of various states or counties or cities because of this delay. The resources are public health resources are not infinite. They're limited. And with everything that is going on in the nation, and some of these folks that were working in public health, putting in the data are now doing contact tracing or setting up surveillance systems, et cetera, and trying to figure out how to deal with it. So there is an issue with how many people are working on it. So having talked to my friends who are health officers or epidemiologists working at state health departments in California, Texas, and various other states, they all acknowledge the fact that there is a delay in the reporting of the data right now. Some of them, tell me that they don't have enough resources. We are, as a nation, facing not only the coronavirus, we are in the hurricane season right now. And, for example, in Florida and the Panhandle, and if you go down south, all those states are dealing with another emergency and getting ready for it, getting prepared for it. And it takes a lot of people to do this work. And the resources are allocated to some other catastrophe that's going on or impending catastrophe that is happening, then there is going to be delay in the reporting of data. But, it's a very important observation. It's a very critical thing, because if we don't know exactly what is going on, we cannot prepare for what is coming next. So I hope that the data glitches are temporary and they will be fixed very soon. Some of the websites have disclaimers that the data is going to be reported a little bit later. So we'll keep looking at it. But I think that we've got to provide more resources to the counties, to the states, and all the folks that are working on these dashboards to put in the data in a very expedited and accurate way to see what is really happening.
Yeah, I know that is a priority for health officials here to fix that glitch in the state of California. Dr. Chotani, always a pleasure. I know the folks there in Laredo, Texas appreciate your great work, and we'll be chatting with you again soon. Thank you so much.
Thank you so much for having me, and wishing everybody the best. Last thought is, unfortunately, the deaths in the United States of Americans is, increasing every single day. If everybody wears a mask, we can decrease the deaths by 60 to 70,000 by the end of this year. So let's focus on that. Young folks, you gotta help us out because we just do not want any more deaths. As we don't want one more single death due to coronavirus, but let's save as many people as possible. And data and research is clearly demonstrating that if every single person, 100% of the population is wearing masks, we can save approximately 70,000 lives by the end of this year. So with that, thank you so much for having me, and have a great day.
Yeah, that is a very important last message. Thank you so much, Dr. Chotani. We'll talk to you soon.
Thank you.